I'd like to introduce today's speakers, Kaitlin Murtagh and Trudy Tchume-Johnson. Kaitlin is the outpatient education coordinator with the Valerie's Fund Hematology and Oncology Clinic at the Children's Hospital of Philadelphia, Voorhees Specialty Care Network Center in Voorhees, New Jersey. She partners with an interdisciplinary team to provide organization, planning, and delivery of educational support services to patients seen in the clinic. As a licensed social worker with over 23 years of medical social work experience, Trudy Tchume-Johnson, MSW, LSW, believes chronically ill children deserve the same opportunities as any other child. She is presently the social work manager in the Division of Hematology and program manager of the Comprehensive Sickle Cell Center at the Children's Hospital of Philadelphia. Her expertise is in providing psychosocial support for chronically ill children with sickle cell disease, newborn screening for abnormal hemoglobinopathies, and program development. In 2018, Kaitlin and Trudy co-authored a comprehensive and user-friendly school-based handbook entitled Supporting the Student with Sickle Cell Disease, a comprehensive handbook for your school community. This handbook contains the latest information on sickle cell disease, promotes proactive planning, and supports the development and implementation of individualized academic action plans for students with this chronic illness. Throughout their careers, Kaitlin and Trudy have been committed to sharing information about their work and the creation and dissemination of school-related documentation and resources. They have been afforded the opportunity to share their work in several national conferences since 2018, and most recently, they have won the award for Best Abstract in response to a NASM report at SCDAA's 49th Annual National Convention. And so with that, I will turn it over to the both of you.
Hello, and thank you so much. My name is Kaitlin Murtagh, and I'll be speaking for the majority of the remainder of the presentation. First and foremost, I want to thank you for making the time to listen today. I am hopeful that our audience is going to be able to do several things by the end of our talk. They'll be able to identify our inequities in education that are caused by direct and indirect disease-related factors for individuals with sickle cell disease. They'll be able to recognize the role advocacy from psychosocial team plays in the development and dissemination of resources developed for caregivers and for school communities, on appropriately managing the clinical, academic, and social needs of students with sickle cell disease. You'll be able to assess preliminary data that's been collected from a sickle cell disease-specific educational needs assessment and evaluate our current practices as well as our next actionable steps as we continue to enhance proactive communication about disease-related factors that may impact individuals with sickle cell disease in the school setting. Next slide, please. Just to be clear, we have no conflict of interest. So as you heard a little bit about our sites, we, across the three sites, our Comprehensive Sickle Cell Center at the Children's Hospital of Philadelphia main campus or University City campus. We have our Voorhees Specialty Care Network Center in Voorhees, New Jersey, where I am located, and our King of Prussia Specialty Care Center in King of Prussia, PA. And across these three sites, we are able to provide care to more than 1,100 patients living with sickle cell disease. Almost 90% of those patients are what we would consider school age, and that includes anywhere from daycare settings all the way through college graduation. Next slide, please. The 2019 article, The Link Between School Attendance and Good Health, states that more than 6.5 million children in the United States, which is approximately 13% of all students, miss 15 or more days of school each year. And the rates of chronic absenteeism vary between states, communities, and schools, with significant disparities based on income, race, and ethnicity. Chronic school absenteeism, starting as early as preschool and kindergarten, puts our students at risk for poor school performance and school dropout, which in turn puts them also at risk for unhealthy behaviors as adolescents and young adults, as well as poor long-term health outcomes. Pediatricians and their colleagues caring for children in the medical setting have opportunities at the individual patient and/or family, practice and population levels to promote school attendance and reduce chronic absenteeism and resulting health disparities. To address school-related inequities students with sickle cell disease face, we must also recognize that these inequities are not unique to the changes in learning environments that have occurred over the past 23 months as a result of the COVID-19 pandemic. Next slide, please. And to address the system-level inequities, we must consider the importance of interdisciplinary representation in the care of our patients with sickle cell disease. Feedback from our stakeholders within the Comprehensive Sickle Cell Center, our patients and families, school personnel, and the partnerships we have cultivated with community-based organizations and sickle cell disease providers outside of our organization have helped shape the information that has influenced the development of our school outreach tools. Next slide, please. Our work to address school-related inequities is long-standing. As you can see here, as early as the late 1980s, the team at the Comprehensive Sickle Cell Center identified the need for this layer of support and understood the importance of interdisciplinary representation in the care of patients with sickle cell disease. Over the past several years, however, the depth with which we have sought to promote proactive communication and programming for our patients has intensified, beginning with updating requests for educational plans like 504 plans or individualized education plans, also known as IEPs, refining and repurposing a school-based handbook, and adding a tutoring program as a proactive measure to help reduce poor long-term academic outcomes. Next slide, please. In 2016, an interdisciplinary team reviewed and revised the existing school-related documentation that was being used to request educational plans, including 504 plans and IEPs for students with sickle cell disease. This then led to a total revamp of the way in which this documentation is formatted so that medical and clinical recommendations and educational recommendations live in separate sections of the documentation, thus helping school personnel better understand the medical rationale for the requested accommodations in school. This also paved the way for our team to review the existing literature that was present both in our center and nationally to assist school personnel who work with students with sickle cell disease. An important trend we noticed is that the information that previously existed wasn't as user-friendly to school staff as perhaps originally intended. This led us to completely revise the materials that we share with school personnel and families into a streamlined and user-friendly school-based handbook whose intended audience are educators, school nurses, guidance counselors, before care and after care staff, athletic department staff, and even summer camp staff. The handbook itself includes information that spans the academic career of our patients and provides both a medical overview as well as key academic information and customizable action plans that can be used by school staff and caregivers alike. It's 50 pages in length. It is not meant to be read cover to cover, and it is meant to be used from daycare all the way through college graduation. Next slide, please. We also established an after-school tutoring program known as Sickle Cell Strong, School Tutoring Resource, Opportunity, and Networking Group, which was designed back in January of 2020 and ran through March of 2020. The tutoring program was meant for sickle cell disease patients in the Comprehensive Sickle Cell Center who, due to disease-related processes, are at the highest risk for school absenteeism. Some of the successes of this program include our community building for our student participants, their siblings, and their caregivers, insight into inequities that students with a history of sickle cell disease-related complications face based on school resources, a free program to assist with building essential executive functioning skills such as time management, organization, prioritization, and with building study skills and habits. It also, another success was patient and caregiver reports of increased school-related confidence. And our caregivers overall reported that this type of proactive planning is needed and agreed with its continuation if made available again in the upcoming school year. We're working on reestablishing this program and seeking to find ways to offer it in a virtual format as a result of the COVID-19 pandemic. Our tutoring program was just one of the school-related programs affected by COVID-19. The CDC reports that by the end of March, statewide school closures affected 55.1 million K-12 public school students across our country. And while everyone continues to feel the impact of this virus, the effects are hardest among those who are most vulnerable. And with this in mind, as well as with the CDC's information highlighting that individuals with sickle cell disease are at an increased risk for severe illness from COVID-19, Trudy and I were inspired to reevaluate our current practice. We are cognizant that there are direct and indirect disease-related factors that leave school-age individuals with sickle cell disease disproportionately affected by inequities in education. We also know that the need for proactive programming, documentation, communication, and advocacy aimed at building and supporting the academic and social competencies of school-age children with sickle cell is imperative. It's equally important to recognize the work that's being done by others who share our concern, most notably the findings from the National Academies of Sciences, Engineering, and Medicine's 2020 report addressing sickle cell disease, specifically recommendation 5-3, which the U.S. Department of Education should collaborate with states' departments of health and education and local school boards to develop educational materials to provide guidance for teachers, school nurses, school administrators, and primary care providers to support the medical and academic needs of students with sickle cell disease. Next slide, please. And so to do this, we must understand and address social determinants of health, social risk factors, and social needs to improve the care of sickle cell disease patients. This led us to developing a system and a process to track school-related barriers resulting in inequities in in-person education and inconsistent access to technology, as well as to establish a system to track the dissemination of school-related information to patients, families, and school personnel in a secure format as a means of a protection measure to address educational inequities. We set out to do this by utilizing REDCap as our secure electronic platform where families could complete and sign school-related releases of information. We then worked with our institution's legal team and received approval for transferring these paper-based releases to an online format and a secure platform. We developed a sickle cell-specific educational needs assessment that families complete along with the releases of information so that we're able to benchmark academic information and identify further needs for resources for caregivers, students, and educators to support academic development. Next slide, please. As early as June 2020, we met with colleagues, patient families, and with the medical team to identify school-related successes and barriers. These meetings provided us with tangible information about the impact that COVID-19 specifically was having on proactive communication between our staff, our families, and school personnel. We knew that we needed to do something to help our families overcome these barriers. This led us to prioritizing the development of a workflow that would enable us to continue to track school-related successes and barriers, to be able to address those barriers related to inconsistent access to technology and inequities in education, and to establish a system to track the dissemination of school-related information to our patients, their families, and school personnel in a secure and user-friendly way. Next slide, please. The result is this information, which is currently available on our electronic database. We share a link or a QR code with our families and ask them to complete these 3 forms. A release of information, giving our office permission to share information related to the student's hematologic diagnosis with school personnel in order to secure Section 504 accommodations or accommodations in an individualized education plan. We also have the Federal Education Rights and Privacy Act, or FERPA form, which provides permission for ongoing 2-way communication and educational record sharing between our clinic and the student's school, and the Sickle Cell Specific Educational Needs Assessment form. This form captures demographic information about the school, the student, their successes and barriers with learning, prior implementation of educational plans, and provides valuable information about access to technology and the internet, which was critically important during the 2020-2021 school year, when schools in our area shifted to being 100% remote in response to the COVID-19 pandemic. To ensure equitable access to the electronic database for patient families, the psychosocial team, which included social work, myself, the education coordinator, and our community health workers, provided support to families in many ways. We noticed that some of our families, when we were meeting with them, had no access to the internet at home, and so when they would come into clinic, we were able to provide that one-to-one support for them to assist them in completing the releases of information, having them sign off on them. We also noticed that sometimes our families weren't being seen in clinic as often because of the COVID-19 pandemic, so we developed the academic hotline. We also have a public-facing school outreach webpage that we're utilizing. The database was finalized. I'm sorry, next slide, please. Thank you. The database was finalized and access to it was shared with families beginning in August of 2020. This database remained live until June of 2021. During that time period, 155 patient families from our sites used this database to complete school-related release of information and the educational needs assessment. The caregivers who utilized this database found this method of signing releases electronically to be acceptable and feasible, and feedback from our school personnel about receiving copies of the releases, updated letters, and a copy of the Sickle Cell School Handbook was favorable for the continued use of this electronic database and delivery system. Next slide, please. Next slide, please. Thank you. The need to address barriers to technology and further assess academic inequities spurned from the academic hotline and information gathered from the electronic database. From this, we were able to create an even more detailed sickle cell disease specific educational needs assessment, which addressed the following areas: access to technology, access to non-shared devices, and access to the internet at home. We were also able to gather growing interest in the virtual tutoring option if made available. We were able to identify the type of school setting that our patients were enrolled in, as well as their current educational and academic plans. From this, we were able to gather results. So by the end of the 2020-2021 school year, we were able to, in real time, figure out where those barriers specifically with technology lied. And by the end of the year, you're seeing this slide here, which shows that the majority of our patient families had access to a laptop or a Chromebook, but over 90% of them had access to some form of technology device. Next slide, please. We also were able to make sure that our patients did not have to share their device with any other members of their household during the school day. So by the end of that school year, the overwhelming majority of our families did not have to utilize a shared device. By the end of the school year, we had close to 99% of our patient families who had consistent access to the internet at home. Next slide, please. And the overwhelming majority, about 90% of our families identified that if a virtual school tutoring option was made available, they would be interested in having their student participate. Next slide, please. We also were able to find that our students, by the end of the school year, a little bit more than 50% were able to have a plan in place at the start of the school year. By the end of the school year, we were able to identify, next slide, please, that the overwhelming majority of those students had at least a 504 plan in place. So taking all of this information from what we were able to learn, understanding that during the 21-22 school year, which is where we currently are, most of our students would be returning to in-person learning. We decided we needed to reevaluate some things that we were doing. And so this information was able to give us the data that we needed to make some key developments and the support that we provide to families and school personnel. And the first was that revision of our educational documentation, our 504 plan request letters and IEP documentation, which now includes the COVID-19 clinical recommendations as well as requested accommodations specific to remote learning. We also developed, using the feedback that we received from the Sickle Cell Strong program, it led to the creation of a public-facing hub of educational resources for caregivers to assist them with areas like remote learning, skill instruction, special education resources. And this resource lives on our chop.edu webpage and is free to the public. It's also linked on our Sickle Cell School Outreach webpage as well. Over the summer, we prepared for the 21-22 school year and the return to in-person learning by opening the electronic database to families. We did this earlier than we had in the previous school year. So we wanted to make sure that our families had access so that they can continue to work on proactive communication. So in May of 2021, we opened the electronic database for the 21-22 school year. But before this database went live, we revised the educational needs assessment form. We wanted to include a place for caregivers to share more school-specific information, namely the type of school that their child attends, whether it's private, public, parochial, cyber school, whether they're homeschooled, as we believe that this information will give us valuable understanding of the type of resources that are available. We wanted to make sure that we understood whether or not it was the first year that the child was in that school. We wanted to see if we could have caregiver permission for specific documentation for physical education staff and a medication form for school to also be completed so that we were providing a more complete package when we sent the information out to school. And we sought caregiver feedback on their satisfaction with the direct communication that they had had with school personnel during the previous school year. We continue to be mindful of the academic inequities that our patients and families face. So in addition to the academic hotline that we had already established and the Sickle Cell Disease School Outreach webpage, we also created a shared email account that our patients and families, as well as school personnel, can use as a way of communicating with our team. We also use this email address to send out our school-related documentation to our school personnel and caregivers, so it's coming from one streamlined source. And given that we serve more than 1,100 patients each year, organization and follow-up on the administrative side of our work is incredibly important. That's why we added an administrative tracking tab in our electronic database that is only seen by our team. And the reason we do this is to ensure that we are following up on any outstanding tasks related to the creation and dissemination of the school-related documentation that we're working on for our families. It also serves as a way for us to identify who the point of contact will be from our team, that will serve as a representative for our school meetings. Next slide, please. The successful implementation of this system for obtaining and disseminating school-related information has led us to continue this process during the current school year. So to date, over 264 patient families have utilized the database to complete and sign school-related releases of information and to complete our more revised educational needs assessment. We continue to use this information provided to track trends with academic successes and barriers reported this school year, and our current data shows that caregivers still have a vested interest in a tutoring program if it's made available. We plan to continue to review caregiver reports of successes and barriers with the dissemination of school-related information on an ongoing basis so that we can continue to address social determinants of health, social risk factors, and academic needs to improve the care of sickle cell disease patients. Next slide, please. We hope that after today's presentation, you'll please use the links that we have provided to access our school-related resources throughout our Sickle Cell School Outreach webpage, as well as our Educational Resources for Caregivers webpage. And for further information or to learn more about how our team can partner with you, we encourage you to contact us either by telephone or by email. We want to acknowledge that we would love to assist other programs in building their own resource hub and systems for disseminating and school-related information. So we're eager to partner with you if that's something that you're interested in. Next slide, please. We have our references. And before we move on to our Q&A, we do want to take a moment to acknowledge those who have been instrumental in supporting this work. And in addition to the individuals listed below, we are especially grateful and eternally grateful to our caregivers, our students, our school communities, and our sickle cell disease community partners who have shared their experiences with us. We greatly appreciate their work, and we look forward to continuing to serve them. Thank you so much for this morning's presentation, and we look forward to taking your questions.
Wonderful. Thank you so much for your presentation, Kaitlin and Trudy as well. It was extremely informative. I apologize for the ghost keys. My system is jumping today. At this time, we will take questions. And as a reminder, we take our questions through the chat box or question function on the control panel feature of this webinar. So I will turn it over to Susan to get started with our Q&A.
Thank you so much. That really was so helpful. I will say that for me, listening to you though, what it really brought up was so many more questions than answers. And so I'm going to hit you with some of those to start with. And there are already a couple of questions in the question system as well. And so a first question I have, just a point of clarification. So the system that you set up during the COVID timeframe, that's what you're talking about extending into the future so that people can continue to have the same level of communication with both the clinical staff and the school setting virtually, right? That is so, and also you'll continue to be collecting this information. Did I understand that part right?
Hi, Susan. This is Trudy. I mean, yes, I think we, and Kaitlin, please jump in if I misrepresent this, but I feel like even though this started with the energy to just ensure that our patients have equitable access in school, it's almost like now we can't turn back.
Yeah.
We have this has simplified our workflow in a lot of ways and has helped support us in being very efficient. It has helped increase communication with schools. What I think one of the things that was highlighted the most was a reduction in some of the challenges that our patients report maybe in the springtime to us, that now we're seeing it's not happening the same way, and we're able to support school personnel in real time. It's just encouraging really nice opportunities to catch challenges or create plans around nuances that are specific to that school in real time. So yeah, definitely no way we're going back.
That's really, that's helpful, and that makes a lot of sense. In terms of the system that you had in place prior to COVID, what were the substantial changes in terms of your system? Obviously, there were huge changes for both the students, their families, and the school systems. Lots of changes there. But in terms of what you were doing prior to COVID, though, there was still an information flow, a communication flow that was happening. It was just more in person, it sounds like.
Yes.
I guess that's the part that I'm not quite clear about.
So just referencing our sites and the numbers at each site, our systems unfortunately were also a bit different. Our Voorhees site has Kaitlin as their education coordinator who can focus on the needs for the patients of that site. But at our main campus site, we hopefully soon will have that as well. But we had to create something that our social work team could help support executing. What we all collaborated on doing was creating pamphlets and booklets. Over the years prior, we had booklets for our elementary school students, and we had, folders for our elementary school students, and we had folders for our high school students. We had daycare letters as Epic. We used Epic as our EMR system. We had letters for daycare providers in our system so that if a family in real time needed a letter for their daycare provider, we were able to provide that. So we had that type of flow, and we did a lot of education in person, going through these folders that sometimes, in a lot of cases, the folders never made its way to the school, or it made its way to the school and it was left up to the school to interpret everything that we needed them to do. So being able to partner when Kaitlin joined the team and try and see this from the lens of an educator was vital, and that also helped influence how we move forward with how we disseminated information, how we succinctly changed information, and COVID just took us to this level of thinking when we thought through outreach.
Yeah, it encourages creative thinking, I think, in a lot of different ways. Thank you. That's really helpful to understand. So the next couple questions are a hybrid of things that I wanted to ask, as well as what some of the audience members have put into the question boxes, and they are they're reflective of how you could think about implementing the work that you've done, and that's where I just was it's much more substantial than just this change since COVID. There was a tremendous infrastructure that you had in place prior to COVID. And so asking you a little bit about how that was implemented with CHOP and with the families who come into CHOP, how it has been financially supported, where the funding comes from to do this kind of a program, and how far through the course of the educational system your work goes. So you mentioned at the beginning that you do work with college students, and you have mentioned that you work with preschool. So just a little bit about those different phases of life and what's required. I think many of the folks on the call don't have access to this amazing thing that you all are doing at CHOP. And so just trying to hear a little bit more about that. So the first question was really, how is this work financially supported? How are the resources garnered for you all to do this work, support your time, and support the development materials and those kinds of things?
And Kaitlin, please jump in too.
Okay.
So I think that's, I mean, because of our understanding of our community, that's another reason why we did the work. A lot of the work that we've done can be downloaded for free off of our website.
Great.
We like a lot of the templates the handbook can be downloaded. Each template, for instance, daycare template, summer camp template, before and after care template, templates that can be used with the school, they're all free downloadable documents off of our website. Granted, to this information, we put it together in 2017, 2018. And we have to sit with it and revise it based off of some of the things that we've learned now, but the crux of it is still adequate and still is a great base for people to develop their own. So we're hopeful that that is one way that people can mediate cost by just being able to refer people to a site where they can download what they need. I think when we think about partnerships, we should think about how to tailor your approach in addressing the educational needs of your site, specifically to your site, because what we have access here to it is different than other sites. But we've been able to work with other teams in creating something similar, so that they felt supported and they felt like they were being supported, and it actually matched the workflow that they have existing at their site. Again, to where one of our sites we're over 950 and the other site we're at 150, but our work and who can do this work has to actually fit the workflow. So I think we can definitely work with teams to think through what they have existing and how they can modify what they want to present to their families and their education systems. If we modify something uniquely to them, create something uniquely for them. But yes, they can access everything from our website for free. We plan to keep that space a space where people can access material that they could revise, they can develop, they can create as a free resource to our community.
Thank you. That's really helpful. And so it sounds, actually, I won't go there. I'm going to jump into another question. Can you talk a little bit about the different types of support that are necessary and that you're able to provide for people in different age ranges? So obviously the supports are going to be very different for elementary age kids or preschool age kids than they are for college students. Are things like the online tutoring, the virtual tutoring, are those available across the board, or what looks different across the ages?
Hi, this is Kaitlin. I can speak to that a little bit. So one of the things that we looked to do was to really identify some of the key changes that occur throughout the school-age child's academic career. We know that in a daycare setting or a pre-K setting, there's going to be information that's more relevant to the caretakers, the school personnel, because the child themselves might not have the language to share if they're not feeling well, so things to look out for, and it's much more medically based. As the child enters elementary school, we're really looking to identify both the medical information as well as key academic information. So how a complication, for example, might present in the classroom setting, and what to look out for, how to address it. Some of the psychosocial concerns in terms of physical development, how that might appear, and look and what to address or how to address it, how to work collaboratively with the child and their caregivers in a way that feels comfortable for everyone without sharing, unnecessary information about their diagnosis with all schools staff. We also want to make sure that, during these key milestones, like, we're going from kindergarten to third grade, where we go from learning to read to reading to learn, that we're addressing, potential academic issues that may arise. As we're moving forward into high school setting, we're also trying to target our guidance counselors to help them identify ways in which educational plans like 504 plans or IEPs will change once our students graduate and move on to college, so that those plans don't necessarily follow them. They need to self-advocate. And so our guidance departments are really crucial in helping build those foundational skills and partnering with us. And we're also looking to make sure that we're addressing some key areas. So what might appear as chronic absenteeism may very well be a disease-related process, which means that the student is going to be absent more frequently than their same age peers. So just gathering a better understanding from the school personnel's lens. And to that point also, with the tutoring program, yes, it is available. It was available to our school-age patients, but we did have some identifiers that we prioritized just because of the number of patients that we serve. So what we were looking for in identifying are quote-unquote higher risk patients, meaning they're patients who, for one reason or another, tended to be more chronically absent. Specifically, those who are on transfusion protocols, we wanted to address that because we knew that they were going to have 1 to 2 planned absences every 3 to 4 weeks. And that is huge when you add up the amount of time missed from school throughout the school year. We also wanted to address those who have had a stroke or at a higher risk for a stroke or had silent infarcts. I hope that addresses it.
Great, thank you. That's helpful. So what I'm going to go to a question about materials translation. So there's a question about whether the materials in it, and I'm assuming that the focus there would be on the materials for the families and the young people with sickle cell disease, whether they've been translated into any other languages, and the two in particular they were asking me about were Spanish and Creole.
That's a great question. We do have a few documents on the site that are translated already into Spanish. Of course, there was a question earlier about cost. This is a huge cost that we have. We have definitely dedicated money in making sure that we can have that translated. The only thing that we're doing this quarter is just revising everything before we translate again, just to maximize on that piece. So, but there are a few documents on the site that are already translated into Spanish. And, you know, we plan to be able to provide this service and translate all of the documents into the respective languages as well that were mentioned.
That's wonderful. Thank you. So Naomi, is it possible to put the slide up that has the link directly to the materials? I'm not sure which slide that is. There are a couple of folks asking for that. Thank you. There you go. Perfect. And just to let everyone know, I noted in the question as well, we'll be sending out to everyone who's listening right now, everyone who's registered for the webinar, we'll be sending out a link to the recording of the webinar, and that will also have a link to the slides. So you'll be able to see the slides and have these links directly. Another question about working with the school systems, and this was one of the ones I had as well. It sounds like you've been doing this for quite a while, so I'm sure that you have some established relationships. But in the beginning, when you first began doing this work, what was the outreach like from your perspective? Where did families come to you and say, my child is in this school system and these are the problems that they're having, and you did outreach maybe directly to a particular school site around a particular problem, or was it a more top-down global approach where you went to school districts or maybe even to the state Department of Education and said, you know, we'd like to assist you in working with this community, and we have these materials and that kind of thing?
I would say, and I'll let Kaitlin speak to the New Jersey side, because we serve this tri-state area, New Jersey, Delaware, and Pennsylvania. I would say on this side of the bridge, we historically, when we learned of a patient care need, we worked with families to have conversations in their respective school. There were always opportunities for us to, through our state, during our advocacy day that our local CBOs will put together, to bring up these topics around the need for students to have what they need in the school systems during those sessions with our legislators once a year. So I would say, like, over the years, that we knew that there was at least that space. I think what has moved things forward is the fact that now we're capturing data, succinct data, in a way that it's measurable. We can show people the numbers. We can show some of the concerns that come up for our patients and our families. That's a bit irrefutable. And that has actually led to our ability to be able to partner with our CBOs in a meaningful way, with provide data to help support some of their conversations with legislators that they work with. But it's also helped internally, just showing our teams and our staff maybe areas where we can build something different that actually meets a need better. For instance, that has helped inform our practice around now including the medication authorization form as part of the information that we just send out to schools instead of waiting for families to request it. I would say overall on this end, that continuous partnership has with our patients and families and other stakeholders has influenced how we've moved through trying to support needs for the 950 that are on this side of the bridge.
And I would say in New Jersey, it's very similar to the process that exists in Pennsylvania as well, with the additional fact that my position exists just in New Jersey, our New Jersey location. And so my role really is to be a liaison between our clinic staff, our families, and their school teams. So one of the things that I had established early on was sending out a letter of introduction about my role to the school districts that I serve, that our patients are enrolled in, and just really trying to open the door and open the lines of communication to help a better understanding for the need for ongoing collaborative communication and to empower our school personnel to ask these types of questions, and also to empower our families to have these types of meetings early and often, so that we are all on the same page. And that's something that we're hoping, as Trudy said, can transfer over into our Pennsylvania campus as well at some point.
Yeah, that makes sense and sounds great. And Kaitlin, when you do that kind of outreach you were just describing, I mean, are the school systems, are the school personnel that's generally positive and engaged around this, or is there more work to be done there?
I think there's always more work to be done. I do think that it is school type and school district specific. However, I will say that I've received a lot of positive feedback from schools overall, because in essence, what we're doing is providing them with a service. We're giving them information that they wouldn't otherwise necessarily have in this to this level or to this depth. And we are offering a line of communication to support them in their ongoing work with these families. We're also giving our families a lifeline to help advocate for their children. And so it's been overall very, very positively received, but I do still think that there are things that we're continuing to do to make sure that it's universal, and right now it's not. So there's definitely work to be done.
Yeah, that's a great framing. I really appreciate that. Two more comments that have come in. So one, and I was reflecting on this a little bit as well about the translations. The audience member says, we found collaborating with CBOs in our community of practice to help with translation. That's also helped strengthen our relationship with them and the shared families. That was something I was thinking about as well. Our team in California has been collaborating with the State Department of Public Health, not around these educational materials, but around some other materials. And one of the things that's a challenge for that entity, the Department of Public Health, is that if there's no budget for whatever reason to do translation or to do printing or to do those kinds of things, they can't make those things available without some kind of budgetary shift. You can't just decide to do something when you're in state government. And so that's one of the places where a community-based organization or an entity like ours, which is grant funded, and we can write into our grant, let's make printing for these handbooks available, or translation, or those kinds of things. So I guess this is less of a question and just sort of a data point for anyone who's listening and thinking about scaling and implementing things, that those partnerships can really support it. And I don't know if that's been an experience that you've had as well.
From our end, yes, I know that we have state-related grants too that support education. Mm-hmm. And we do write in we'll write in for the purchasing of different materials and so forth. So it's definitely possible from that lens, but I would say when it comes to the development of these documents, because of the necessity that we needed in trying to create something that we know would work, and we needed to create these things pretty quickly.
Mm-hmm. Sure.
If you use these grants if you use this grant funding to actually develop the material, you also have to run these documents through them as well. and consider the time that was needed that way. I think at the time that wasn't a need of ours at the time. So I would just say to also include that breadth of time if you're using any type of grant funding to help support your work. Just time for the grant administrator to also be able to review and provide what you need in terms of logos and so forth to add to the document that you create.
Yeah, definitely important considerations when you're collaborating and co-branding. There are a lot of extra steps and extra questions and extra hoops to jump through. So yeah, agree. And then I'm gonna ask one last question. I'm gonna reframe it a little bit. Oh, we just had one more come in. Let me double check what that is. Okay, I'll ask a quick one and then a little bit longer one, and then I think we're gonna stop. Sometimes everyone is so interested in the work you're doing that the question period can go longer than the presentation. So we really appreciate your feedback in answering these questions. So the first one is about homebound students, and the question is particularly about high school students, but I know that the homebound situation it can happen outside of the COVID timeframe. And for children with sickle cell disease, kids can end up being home for a very long period of time with consequences of the illness. And so both with the COVID time and prior, how does that change the outcomes, change the situation for those kids and their relationship with the school? And I think the question I'd like to ask, I'm not sure what the questioner was asking, but is about outside the COVID period, because within the COVID context, everybody was, or not everybody, it might have been hybrid, but there were a lot of people being educated at home. And as we go back to the more normal model, I think we have to think about that issue again. That was a long question. Sorry about that.
No, so it's a great question. It's something that is an evolving process, I believe. So what our institution, the philosophy is that really homebound instruction for our patients with sickle cell disease is something that we're really trying to limit. We are, pursuing every option for them to be able to attend in person as much as possible, but we also recognize that there are complications that arise that would cause extended absences from school, in which case homebound instruction would be the most appropriate form of education. So in terms of what we're doing for that, or how we continue to build relationships, it's important to recognize and empower our patients and families to know their rights with homebound instruction, and that does vary state to state, but speaking specifically from New Jersey, 10 absences or up to 21 absences during the typical school year would entitle a student to have homebound instruction. 10 consecutive absences, I should say. And so, if that's a student who's doesn't have special education or related services, they're entitled to those 5 hours a week. Special education or related services students have 10 hours a week. And it's really about making sure that school districts understand the rationale for why the student is home, and identifying a way in which they can collaborate with their school. I think the fact that we have so many technological advances that have happened within the past 10 or so years in education has really allowed us to help our students to log in to their learning online learning system, to be able to complete work as they can, to have that connection with school teams, but also to make sure that they're staying on track with their assignments as best they can outside of the scope of that homebound instruction. But it really is so individualized to the child or the young adult, and the district, the state, so on and so forth. So it's a tough question to answer universally.
Yeah, that makes sense. Thanks. I appreciate that that response. So, and I'm going to just ask one last question, going all the way back to the beginning. You talked about the multidisciplinary team And the question is, could you just define who's involved in that team? So what are the specific components of the multidisciplinary team that you have working on these activities?
Sure. So we were able to have a number of colleagues within the Comprehensive Sickle Cell Center that ranged all the way from our division chief at the time, Dr. Kim Smith-Whitley, to members of our hospital school program, including myself, some of our hospital school program educators. We had our social workers, including Trudy, our Sickle Cell Center psychologist, Jen Brereton. We had our community health workers who were part of this. We also collaborated with our stroke program to get their information and educational assessments or data that they use to support patients who've had a stroke. And, you know, caregivers and families. This was really important for us to make sure that their voices were being heard.
Right.
Well, I think another important role that we had involved was we have an adult care transition team here at the hospital. We had a representative from their team also review the information, and we also had a health literacy consultant also review it as well.
Wow. Okay.
Just to make sure that even though the focus of this information is going to school personnel, we still wanted to make sure that they could embrace the information and see how they can integrate the information into a reasonable plan to support the student. I think the other thing too, even though we mentioned it and we took screenshots of what we send to schools, I think having another space to like being able to share with other partners what's the language actually that's in the IEP and the 504 and IHPs letters that we create. We review that annually, and we really approach giving information to schools from in a way that anybody should be able to look at it, and you should be able to create a plan that's succinct. It's formatted in a way that schools are used to receiving this type of information, these request letters. I think if anything from our end, we have a lot of information there. So the nice thing about this database is that we now have this communication with direct communication with the schools, where if they have any questions about what's there, I know I've been in a position where we've had to refocus them to a particular section so that they see that the information is there for them. So we'd love to show people like what exactly is in the letter, so that we can, you know, you're not kind of spinning your wheels on maybe things that we've heard loads of times and we've kind of figured and formatted language to support the needs of the student.
Thank you. Thank you so much for all of this amazing information. This is a topic that we have not covered before on our webinar, and as soon as the idea came up, we realized it was just such a crucial and critical thing at any time, and especially during the last 2 years. So we really appreciate the presentation. And Niani, I'm going to turn it back over to you to take us out.
Thank you.
Sure. I just echo that. Thank you both so much. I'm sure that we are going to get loads of questions if you don't get them directly. This has been wonderful. And thank you all who have participated. This includes the time, concludes the time we have for this session. And I want to thank everybody for participating, and we appreciate you being here. And so we will see you next time.